Hey everyone, welcome back to the Hair Transplant Mentor YouTube channel. My name is Joe Tillman, sometimes known as the original Hair Transplant Mentor. If you're not sure what a Hair Transplant Mentor is, head over to my website, hairtransplantmentor.com, to find out. In today's episode of Hair Transplant Class, it is episode number 18, we're going to be answering the very important question, do you have to shave your head to get the best hair transplant result? Spoiler alert, yes, you do. So let's break down the two arguments about the need or lack thereof for shaving of the recipient area during a hair transplant. And if you're already confused, like what's the recipient area? The recipient area is the area of your scalp that's going to receive, get it? The new hair or the grafts during the hair transplant procedure. I know it sounds simple, but sometimes these things just have to be explained. The first argument we're going to explore with regards to shaving the recipient area is the argument that you do need to shave the recipient area for the best result possible. So, imagine this scenario. Your hair isn't gone, it's just thinning. You're not bald, you've just thinned throughout the top or in some specific area, and you want to get it filled in. The argument that you have to shave part of the scalp or the entire scalp just to address a particular area is that if you're shaving the top of the head, then it allows the doctor to see in between existing hairs so he can fill those spots and match angle and direction without causing harm. It's a very logical explanation, it's a very logical viewpoint, it's a very common sense kind of approach. And when we look at the other side of the argument, where clinics are telling you that they don't shave the recipient area, there's obviously a reason for that as well. And when you look at the broader scope or the experience that most of these hair physicians have, you know, they got started many years ago when strip surgery was the dominant form of hair transplant surgery, where if the top was shaved, the back couldn't be because the patient still wanted to hide that incision that was closed with sutures or staples. So for the first couple weeks, if that head was shaved, the staples or sutures would be visible, be very obvious that something was done. And the goal for this by most patients has always been to avoid knowing or people knowing that you had the procedure in the first place. It's not like today where you go have an FUE only procedure and they shave your entire head that you look like you had a surgery a week later because the donor extractions heal, your hair starts growing back immediately anyway, you got this buzz cut look going on after a couple of weeks, it works. But with strip surgery, it didn't because you had that big line and it just kind of looked ugly. So it made sense to want to cover it with longer hair. But doctors had to learn to place hair into unshaven recipient areas where there was longer hair in the way, and so that's just how they learned how to do it. Now keep in mind that we're talking about better clinics here. We're not talking about bottom of the rung, clinics that no one's heard of or that have bad reputations for causing problems. We're talking about the good clinics out there. We're talking about the clinics that have long histories with great reputations for consistent results. So when you look at how these clinics are doing their procedures, they're wearing magnification when they're making the incisions, they're parting the hair, they're able to see the gaps, they're able to see the angles, they're able to see the directions, and they're still able to make the incisions in a relatively similar direction and angle to the native hair so that when the grafts are placed and they eventually grow out, it all grows out and looks fine. To get back to the question that was originally asked, is it necessary to shave the recipient area for the best result? The answer is yes and no. Yes, both answers are correct. How can that be? If the clinic that you like has a very specific way of doing their procedure, then you go with what they tell you. So don't ask a shaving clinic to not shave you. If you don't want to shave your scalp, then don't go to this clinic because you're just going to f what they do. if you want to go to a clinic that doesn't shave the recipient area and you're going to ask them about shaving and say, don't you think it's a better idea? Then you're questioning, one of the core fundamentals of how they do the procedure. And I just don't think that that is the clinic for you. If you think that is probably the best way to get the best result, then go to a clinic over here that does shave and vice versa. So that's why both answers are correct. So when you're doing your research and you find out how they do their procedures, you ask yourself, are you comfortable going through what they require in order for you to come in and sit down for a surgery? I hope that makes sense, because it's like going to, a great artist that works with oil and asking them to work with watercolors. Are you going to get a great result? Maybe, but is it going to be the same as what got you or got your attention to begin with? No, most likely not. So when you apply this to the surgical aspect of hair restoration, I think it makes sense. Don't try to get them to do something that they're not used to doing or that they don't feel is in your best interest. So I hope that makes sense. And so I hope that was helpful. That's it for hair transplant class number 18. Thanks for sticking around and stay tuned for the next episode. Peace.